I'm Gordon Smith, the State's Director of Opioid Response in Governor Mills' office, and it's my pleasure to moderate today's monthly webinar and to welcome all of you. Thanks for joining us on this sunny spring-like day, sort of. We have a terrific program for you today surrounding the issue of naloxone in our main schools. And we have a great group of people to share information with you. I will be moderating. I'll come back and moderate some questions and answers after doing introductions. I will remind you that we have all these webinars lead up to the Governor's Summit, 7th Annual Opioid Response Summit, which will be on Thursday, July 10th at the Augusta Civic Center. We will send out registration for that sometime during the month of May. We're very excited. We've had over 40 proposals for people that want to do breakout sessions, of which we will accept 12 of those to put together with the 8 that we've already solicited, and really expect to have a terrific day for you again on July 10th. We'll have another monthly webinar in May. On May 2nd, I will moderate a talk with our former colleague, Roland Robinson, who has a fellowship in Europe to study drug policy in Europe and in South America. And he's now about into his second year of that and has been sending back articles and has agreed to Zoom with us to talk about his work in Amsterdam, Portugal, Brazil. It's going to be a really interesting, I think, discussion about how other countries in this world handle the issues that we're working on. I want to thank Madison Barasser at the Office of Behavioral Health, and of course Lorena Liberty at AdCare for helping us put these webinars together. Believe me, we couldn't do it without them. If you have questions today, I'd ask that you put those in the question and answer box, not the chat box. My question and answer box this morning is over on the little circle with the 3 dots in it that says more. I have to click on that in order to bring up the questions and answer box, and you might need to do that as well. We've got well over 100 people today with us, and again, thanks for joining us. We'll go the complete hour, get done. If there's more time at the end after we get done this topic, I'm prepared to update you on a couple legislative issues. But without further ado, let me introduce our guests today. We're gonna begin with a Gardner High School student, Kaylee Ricker, Kaylee is with us and she's part of one of our youth caucuses that MIRAP has put together. We really appreciate John Reynolds and MIRAP making Kaylee available to us this morning. And she's actually going to open with how this is being done from a student perspective. As I say, she's a sophomore at Gardner High School. Thank you, Kaylee, for taking time from school to join us today. And then we'll start right out with our 2 guests from the Department of Education, Emily Poland, and Tammy Diaz. They're both registered nurses. Emily is the school nurse consultant coordinator for coordinated school health within the Office of School and Student Supports at the Maine Department of Education. Tammy is the school nurse specialist in those same, also in the Office of School and Student Supports. We really appreciate the Department of Education, what they've done in this arena. They'll be talking about their new Chapter 41, the legislation that authorized that back in 2021. And I'm just really proud of the work that everybody's doing here. So I'll just moderate. I'll keep an eye on the questions and answers, probably save them to the end. And then, so we're going to open with Kaylee's got some thoughts to share with us. And Kaylee, again, thanks so much for taking time today to join us, and let us start with a student perspective. You are on.
Of course, I am honored to be asked to do this. Hi, my name is Kaylee. I'm a MIRAP youth organizer And what is that, you may ask? We are a group of young people working hard to help our community to be safer, healthier, and happier. We've been working on a project to bring naloxone trainings into public high schools to teach young people about the effects of drug use, how to use naloxone, and the signs of an overdose. So, like me, they know how to save lives if they are ever in that situation. This effort began in 2021 when we created a movie about youth voices in the recovery community, continued with the legislative campaign to pass LD 1315, and it lives on as we just released our youth created naloxone training. We're now working to partner with community organizations and high schools to provide that training to young people. This is very important to me because some of the people closest to me have been saved by naloxone, and without them around me, no, and without people around them knowing how to use naloxone, they wouldn't be here to help shape me into the person I am today, and I wouldn't be here speaking about how naloxone not only saves lives but changes them. I think it's very important to bring more awareness and trainings into high schools because according to the CDC, in November of 2024, 15% of high school students were reported using illicit or injection drugs, and 14% of students were reported misusing prescription opioids. And that is just the students that they know about. But think about how many youth either didn't get reported or don't go to a school. Young people also love people who are using drugs, whether it is friends, parents, or community members. They need to know how to respond in an emergency if it ever appears around them. All I'm asking is that as naloxone training rolls out in Maine high schools, each of you commit to engaging with young people to co-train with you. Young people are the best messengers of other young people. Young people led to fight, young people led the fight to pass the legislation that created this training, and young people should be leading the training as well. Our overall goal is to bring more knowledge about addiction and naloxone to youth. It may be hard to believe, but we are the future. We have the power to change the world, so let's bring awareness to other students who can help shape our future. Thank you.
Wow, thank you, Kaylee. I'm, well, I hadn't heard her whole thing, so that was just amazing. Thank you for sharing that. Um, I'm going to share my screen and get us started. All right, so hopefully you're seeing the right slide there. As Gordon said, yes, we are from the Department of Education, and kind of just adding on to where Kaylee shared her perspective. Um, it's it's so wonderful to hear the student perspective there and hear about as I think about over the past few years the different work that I've been a part of and the department has been part of with Gordon and the opioid response in Maine. Just kind of a brief overview of what we're going to be talking about here. We're going to be talking about what we have been up to in the Department of Education as part of the response to the opioid epidemic. I'm going to talk about some of the different data points and data that we look at the department, and then look at some of the education and assistance that we've been providing out to the field, out to the state, to our partners, to schools, and just give you a taste of the different resources that we've been creating, the materials, and working together to increase the availability of overdose response medication in our schools. So what I'm going to talk about here is more about I'm going to talk about the different sources of data that the department looks at. And as many agencies do, we try to keep the work that we do grounded in both evidence-based practices and informed by data. So I'm going to look at 3 different sources of data that we have access to at the Maine Department of Education. There are many other sources of data, but specific to this topic, we have 3 different sources of data, and that is the Maine Integrated Youth Health Survey, the School Health Profiles, and then the School Health Annual Report. So the Maine Integrated Youth Health Survey, otherwise known as MIAS, probably most of you have heard of that, if not all of you. This is a survey that's done every other year, so it's issued, administered in the odd years. So this is 2025. the survey just wrapped up in our schools. This data monitors the health behaviors and attitudes of kids in grades 5 through 12 about tobacco, alcohol, substance use, mental health, nutrition, physical activities, as well as protective factors. And just for the other piece of this, that MIAS is how Maine participates in the Youth Risk Behavior Survey surveillance system. So you may have heard of that as well. That is data available from all states. And so we have been part of this, the YRBS, but MIAS specifically is the YRBS questions plus additional questions for Maine. And we do have a steering committee that works with external partners and across agencies to determine what are the questions that are most important to follow for Maine. So like I just said, schools in Maine have just finished up administering this survey and in the past week or so, and we really look forward to getting the 2025 data probably by the end of this year. The image here is just one of the infographics that was created with the 2023 data. And just so you are aware that there are several different infographics that are available with different points of data, and those are publicly available as well as the data itself. You can download an Excel sheet, all of the data, de-identified as obviously because this is an anonymous survey. There's no student-specific information shared within the MIAS. So what did the MIAS tell us in 2023? It told us that we know that 5.2% of high school students reported misusing prescription drug in the past 30 days. And for middle schoolers, that's 4.9%. Adolescents have not been excluded from the effects of the opioid epidemic in Maine. We had 606 opioid-related deaths in 2023. And according to the Maine Drug Data Hub, 4% of those were in youth under 18 years of age. And this slide here, you can see that with the Maine Integrated Youth Health Survey, the data over time, we have been seeing a decrease. That's good. So the school health profiles are another source of data, and this is a cycle that goes with YRBS. So the school health profiles are administered on the even years. So when we're not doing MIAS, we're doing the school health profiles. And the school health profiles is a sampling of secondary schools so that's high schools. And the people that are responding to this survey are lead health education teachers and principals. And it allows us to identify gaps in policy at the local level for health policies. It supports local discussions and decisions about needed changes, and we can even see the changes over time. So how the department uses this data is that our health education specialists, our physical education specialists, they use this type of data to guide professional development for health educators, for physical educators in the field. But we can also use this information to respond to questions from our legislators, from school programs, from our partners across the state when people ask, are schools even doing such and such? Well, this is where we get the information from. So we can see here that this question shown is that percentage of schools that tried to increase knowledge on alcohol or other drug use prevention. And did I write the actual percentage in my notes? We're like greater than 90%. So it looks pretty good, right? So in Maine, we're the darker blue, that's the higher percentage rate. Over 90% of schools are doing that. But in another question, because you can look through the data dashboard on these, that only 64.5% of Maine schools provided their health education are written with their health education teachers have a written curriculum that they follow. So 64%. So that we still have some work to do in helping schools establish their health curriculum, determine what their curriculum is going to be. The other piece that I thought was interesting with this is that more than half of schools that report they report having their lead health education teacher, they do not have a degree in health education or combined physical education, health education. So we can see that there are very good things happening in Maine schools, but we also see that we have room for improvement. So the school health annual report, this is what I'm most directly involved in as a school nurse consultant. Each spring, the department collects the school health annual report, and this is a survey that is completed generally by, at least the data is collected by school nurses. And this helps, school health data helps to bridge the knowledge of the healthcare system and health services and education. So because school nurses are kind of in this two specialties, right, of education and healthcare. So I truly believe school nurses have this unique perspective and have unique contributions to the health of school-age children and with their academic achievement as well. So this survey, the School Health Annual Report, is made up of a combination of optional data and required data. So there are some questions that the department can say, yes, schools have to respond to this question. And then there are some that we can't say that you have to, but we get very good response rate on all of them. And so now to bring this back to the topic at hand here, to the harm reduction work that's going on in schools, I wanted to share what we know about the availability of the opioid overdose reversal medications in schools. So I've been in my position for about 8 years, a little over 8 years now, and discussions about Narcan access in school was just beginning back in 2017 when I started, and it really gained momentum in 2019 when I started to hear from school nurses that they were like, should we have this in schools? But can we have this in schools? We're not sure if we're even allowed. So from a lot of informal discussions around that time, I believe that there was only one school in the state of Maine that had naloxone on hand back in 2019. I remember hearing from others that this is never going to happen. It's not going to be needed in schools. But back in the day, we used to say that about AEDs too, and we hope that we never have to use them. We hope that we never have to use an opioid overdose reversing medication in school, but we want to have it on hand just in case. So in 2021, legislation was established in Maine that allows schools to stock and administer naloxone in the efforts to increase safety in school communities should an overdose occur. This slide shows that in the 2023-24 school year, 60% of these SAUs, so the school administrative units or school districts, that's what most people call them, have a naloxone policy in place. So that's an increase from 2022 when it was 22%. Quite an increase, and glad to be able to see that increase over time. On the second set of bars there, has CPA underneath it. A collaborative practice agreement is a term that we use in the school setting for, it's a formal agreement. It's an agreement between their school health advisor, like a physician, and the school nurse to train and designate unlicensed staff to recognize an overdose, this is also used in epinephrine anaphylaxis, recognize teaching the signs and symptoms of an overdose and allowing unlicensed people to be able to administer naloxone in a school if the nurse is not present. So that's what that collaborative practice agreement is. So you'll see that the numbers are a little smaller on the collaborative practice agreement because that takes another step. Like we have the policy in place, now we need the collaborative practice agreement. But we are making good gains. And I just wanted to show a timeline here of what's been happening within the department over time. You can see back in 2019 where we started with Governor Mills Executive Order number 2, which was to respond to Maine's opioid epidemic. A lot of the discussions in my work with working with Gordon started around that time as well. We happened to be updating the health education standards around that same time. So in the health education standards review at that time, we wanted to make sure that it included communication and decision making regarding narcotics. Then in 2020, excuse me, we had a school nurse work group created, and we created a sample policy and protocol for schools to adopt. Along with that, we had a training that we had plans to bring out across the state and really work hard to increase the number of schools that knew about having Narcan policies in their schools. Well, it's 2020, so March 2020, we kind of put a stop to those plans, but the work did still continue. And in 2021, the LD 772, which was that act to permit naloxone stocking in administration schools, that was passed, and which ultimately cleared the path and helped schools understand that, yes, you can do this. We want you to do this. We want you to have it on hand just in case. Then 2023, we had some more legislation that asked us to make sure that health education included the effects of fentanyl specifically, because we're seeing more and more fentanyl in the illicit market. Moving right along to 2024, where we have updated the Chapter 41. Previously, Chapter 41 was a rule that required schools to offer CPR to students at some point during their high school career. It has been updated to require schools to offer naloxone training as well. And that is an optional thing for schools. Many schools are, it's required that they offer it as an optional thing. Many schools are including naloxone education right into their health education curriculum. So that's where we are right now. We are in 2025, and we are rolling out the training that has been created for health educators to help them feel more prepared to teach students recognition of an opioid overdose and teach school staff how to respond. So that brings us to where we are today. And I'm going to hand it over to Tammy to kind of take on and talk about what we are doing right now.
Emily, thank you so much. That's a great transition point. Talking about Chapter 41 and all of the legislation. After Chapter 41 went through and was passed, we had a lot of outreach and questions about it, including who's a qualified instructor and what should the training look like and things like that. And not only were we getting a lot of questions, a lot of the community partners that do a lot of this work that go into the schools were also getting just bombarded with, can you come help us teach? And knowing how many schools there are in this state, and we have some amazing community partners that do go in and provide some support and education in the schools. We thought it might be a good idea to make something that was more accessible more broadly. So we're going to talk a little bit about education initiatives next. So the naloxone in schools education is an ongoing effort statewide through many of our community partners. Currently, we are working with state and partners to release an on-demand training for education professionals who are interested in providing naloxone education in schools. We have provided and will continue to offer in-person training as well. However, rolling out the on-demand course will open up learning to a much broader audience. And up next, we are going to give you a sneak peek at some of the information that's included in the naloxone education initiative that we've been working on. Next slide, thanks. Oh, mine's not catching up, sorry. There we go. So these are the learning objectives for the education that we are going to be offering as an on-demand webinar. This training really aims to promote awareness around opioid-related risk, as well as foster like a non-judgmental approach to handling overdose situations and supporting families. Benefits of this professional development, participating in the training, staff will be better equipped to handle medical emergencies, obviously, related to opioid overdoses, along with providing timely and effective assistance, and also have a deeper understanding of challenges faced by individuals that are struggling with substance use disorders. Supporting a more compassionate and informed approach to their work. Staff members will also be empowered to respond in the event of an overdose without delay, knowing that they have the skills and knowledge to save lives, and also will be effective in passing that knowledge on to their students. I think Emily's getting ahead of me.
Sorry about that.
That's okay. All right. Next slide. This is one of the slides included, and it's really some basic background information on what naloxone is and how it works. And we're going to speed through a couple of these. And then this is also another slide. Thanks for keeping up. This is another slide that's included, and it just kind of gives a more visual of how naloxone works in the body and helps with understanding. And next slide, please. And then we delve into the legislation, which this is kind of a long piece that not everybody loves to get into as much, but it's really important to have an understanding of all of the legislation that's been passed and that's involved. Some of the legislation that you can see here is directly related to naloxone in schools, such as the Act to Permit Naloxone Possession, Prescription, and Administration, while others, such as the Health and Physical Education Standards, are indirectly related as they outline standards for substance use prevention education in schools. All righty, and next slide, please. We thought it was really important to touch on harm reduction principles, and for the people that are going to be teaching students in schools to have an understanding of this. So there is harm reduction information that is offered through this training, and we also discuss services that are available in local communities so that education professionals can support their students and families better. And I want to say too, part of giving, there's probably a lot of information included. I just want to add to, I think having that more well-rounded understanding of everything and all the resources that are available also helps open up conversation in the classroom, so that if people are struggling with things, that they're going to be more likely to talk to their education professionals if they need help and support. So I think that's really important to keep in mind. And then next slide, please. Talking about resources in the community. We, as you all probably know, Maine has gone through to great lengths to ensure naloxone is available throughout the state. We do talk about the Maine Naloxone Distribution Initiative, MNDI, and all of the resources that are available through that program as well. And next slide, please. Then we move on to just some we talk about core elements of effective prevention programs and substance use prevention, and also offer some tools like conversation starters for the classroom to enhance student engagement. Next slide. So addressing stigma in the training was also really important, and discussing the importance of effective communication to reduce stigma and keep the communication lines open. So this is one of the slides included and talked about. Next slide, please. And of course, we talk about recognizing the signs and symptoms, as well as providing step-by-step information about step-by-step overdose response, so that education professionals are able to effectively teach about all of the signs and symptoms and step-by-step response. And last but not least, next slide. We conclude the training with information for staff on how they can support students after an overdose emergency. We've included resources for classroom education in the training as well. And along with the training, Maine DOE has been working with Maine DHHS and other community partners to develop a toolkit that provides a host of information for schools to support policy development, emergency planning, and all things related to naloxone in Maine schools. Next slide. And wrapping up, today we looked at the Maine Department of Education's role in the opioid epidemic, things that we do, collecting and monitoring data, and providing technical assistance and education to the field. I just want to say thanks so much for having us today and allowing us to share all the work that we've been doing to support schools and ensuring the safety and well-being of students through collaboration with schools, educators, healthcare professionals, the state, and state and community partners. We're fostering a culture where students, staff, and communities are better equipped to respond to the opioid crisis. And this work continues to evolve. Moving forward, our focus remains on increasing awareness, enhancing education, and ensuring that naloxone remains accessible in every school that needs it. And next slide. Our contact information if you want to reach out to us, or if you have any questions that you think of after today's presentation. That's it.
Thank you, Tammy and Emily, for the excellent slides and information. We do have some questions. I think I'll start out with one. What have you found to be the greatest barrier and challenge to getting naloxone in this training offered in the schools?
Are you looking to me, Tammy?
Well, I have some thoughts, but yeah, you might also.
I could start. I think if I think about where we were, 5 years ago, 6 years ago, I think that educating people on the need to be prepared, just seeing it as something, as a life-saving measure, getting past the, I guess it would be stigma around drug use, right? And we're saving people's lives. So I think that they're overcoming that hurdle of the stigma associated with substance use disorder, and making it okay. It's okay for us to talk about this in schools, and to be prepared for anybody. We don't know. I mean, schools are public buildings, and we need to be prepared for for anybody that comes into their public buildings, not just the students and teachers. And just opening minds a little bit at the beginning was a challenge. I think there was a lot of it's not a problem here, when we know that it's a problem everywhere.
Yes,
Tammy?
I totally agree with that. And just adding on to that, speaking about this stigma, a lot of overdoses in this population, are probably accidental as well. And so being prepared, accidents happen, even small children pick up things and put them in their mouths. It's just, it's better to be prepared. Yeah.
Yeah, I mean, I think I'd add a couple things. As Tammy and Emily both know, we just completed a report of the overdose review panel, having reviewed 3 adolescent fatal overdoses, a 14-year-old, 2 15-year-olds. These go back to around 2022, 2023. That report, I'm pleased to say, is now just about public. We need to clean up a couple punctuation marks and maybe one typo, and it's been signed off on by the Attorney General. So we'll be sending that over to the legislature next week, and that makes that report public. At one time, that report had in it as many as 29 recommendations from our 15-member overdose review panel relative to adolescent use and overdose prevention. Some of them are aspirational, eliminate childhood poverty, get everybody housed, food security, equal opportunity in education. Really important to have adult mentors in the lives of these young children who, sad to say, dad might be in prison, mom may be still using or deceased. I mean, being raised by one or more grandparents or other kinship care. We, as a community, we can't put it all on the schools, as I frequently say, and we depend a lot on those youth development organizations, and we've tried to put resources into those organizations: boys clubs, girls clubs, 4-H, YMCA. Anybody that is in ability to get their arms around these children. And so I think that all of that has helped break down the stigma, which we absolutely, when Emily and I started this work, she had a little head start on me, but not a lot. We were together by 2019 doing this work before the pandemic. And as Emily said, I remember one alternative school that had naloxone when I began in January, really, of 2019. And look where we've come. And we can't get there fast enough. Now, we're not everywhere. We still have schools that haven't trained. We have schools that don't have naloxone available. But we're making such progress with everybody's help. And I would say the barriers really are still stigma. And regrettably, that stigma is not only attached to the illness, but to the medications for the illness, including naloxone. And so, but we're getting there. Look where we were in 2016, 2017, when Representative Gideon and I took the first naloxone bill to the Judiciary Committee and got 0 votes to even have this medication available in the state of Maine. So making great headway. The second question that comes from the audience, and we've got quite a few here. It's a little off topic, but I think it's in this, sitting here today, I think it's a fair question to ask. You don't know where you'll go with the answer, but a person has asked whether there's concern in the state, and particularly at the Department of Education, about federal proposals to abolish the Federal Department of Education. Can you say anything about that, either of you?
I can say that the department is monitoring and watching very closely all of the things happening at the federal level and continue to be dedicated to serving our schools and the communities in our state. I don't want to say much. Don't think I can say much more than that.
It's actually more a question for really the governor and the commissioner, and
Yeah.
I understand. Tammy, do you want to add anything? No. All
Right
right,
now,
let's go right on.
we're going to continue to do our work.
Let's go right on to the next question. There's a couple good ones that are really on point. What are the children's parents' reactions to having this training in the schools? Is there any pushback from the parents, or are they pretty accepting of it?
I think, as you would expect, there is some pushback from parents, and as with any topic in a school, health education especially, parents have the opportunity to opt their children out of specific content within a school. So yes, schools are getting pushback from some parents, but then again, we have other families that are saying thank you for doing this. Thank you for.
Agreed. Here is another good one. Concern when this is implemented that a young person may be involved in resuscitating an adult or a classmate, and the trauma potentially associated with that. And do we have sufficient resources in the mental health area, given that we know that that's a challenge under the best of circumstances? What can we do for that? Do we have, how do we deal with that? Because those incidents will happen.
They will, and the incidents will happen whether or not a young person is prepared with naloxone too. So I think, one, I would say that it's teaching our kids and that they can help, that they can do something, is good for them, can be beneficial. Part of their health education would be should be including a lot of that. What do I do? This is a hard thing to talk about. What do I do when I have when I've experienced this? Who can I go to for help? So important to make sure that our kids have trusting adults that they feel comfortable accessing in their schools, even if it's not a social worker, a school counselor. Just having a trusted adult that they have at school has been shown to be really beneficial. And then we continue to work on increasing the availability of mental health in our schools and our state. And that's an ongoing and real concern. Tammy?
I just wanted to add to that, this training with, it hopefully will help build trust and relationships between students and the people providing that education, so that just knowing that they can talk about it with someone, so that hopefully that health education professionals will be able to also help them gain access to resources if they need additional support. So.
Next question is, can you share more about the resource library that you mentioned and how health educators can access the naloxone trainers that may be available, that are available?
I tried to answer that in the chat, but I think it didn't work, or in the Q&A. So as soon as everything is available, hopefully soon, there will be a newsroom announcement that will go out. It should be available on 2 platforms. There will also be links that are standing on the Maine Department of Education webpage. There is, and through the emergency guidelines, there is a opioid response space. which I can pop that in the chat for everybody, or one of us can, that it will be available through that webpage as well. But there will be a newsroom announcement that goes out. It will be shared with Gordon and Madison, and they can share it with everyone as well. So it will be shared broadly.
A couple more great questions. Does the training on naloxone include how the person who's receiving the medication may respond when coming back from an overdose? This individual has heard that it can be quite traumatic for the individual coming out of the overdose. So does the training include information so that might be expected?
Just reading the comments, make sure that I understand it correctly. The training, so the training for education professionals does include that information. The training that is being offered as a resource for educators to use in the classroom is much more brief than what we have created for education professionals. And it is based on the national, I'm not going to say it right. It's based on the National Institute of, it was from the National Drug Week, from the professional organization, evidence-based. And those are the slides that we have provided for educators to consider using in the classroom. We're also providing the CDC prevention, substance use prevention resources that were created and released last year. And we can pop those in the chat too for people to look at, because that's already been released and is available on the main CDC main prevention store. So education in the classroom is local control. So we are providing them with resources that they can use in the classroom. As Emily said, the curriculum may vary from district to district.
It's a pretty distinct question, pretty interesting. If a youth, and we recognize that the value of having these overdose reversal products, whether it's naloxone, Narcan, or another product on campus, is that, again, it can be available to an adult that happens to be attending a football game. It could be a staff member, it could be a student. But the question is, if a student is actually revived of an overdose, are the parents of that child notified?
If that happened on school grounds, the school would be following their own protocols for any type of medical emergency. So I can't answer that 100% because it would depend on their local policy. I think you're going to be calling an ambulance. So
yeah, as a lawyer, I would agree with you that while the local school policy would be relevant, in all of these instances, we call 911, and that's going to put into place circumstances that certainly would involve the parents.
Right.
It isn't, I remind you that we have very good laws in Maine that allow our medical community to treat mental illness and substance use when necessary without parental consent. You always try to involve the family, but each individual case is different, and you can understand why you want to be able to do this, to encourage an individual to interact with a school health center or his or her local pediatrician, or you want them to seek help. And while usually the family's involved, there are occasions where they're not, and that's perfectly acceptable under Maine law. This is a little different. This is a traumatic, medical event that's going to involve EMS and probably the police as well. So this is a good one let me paraphrase Leela's question, which really has to do with, and we have a lot of this. It's why we really formed our youth caucuses. I say we, credit to MIRAP for doing all that. But it's really about the issue of kids concerned about their families, not necessarily at risk or using themselves or at risk of an overdose, but really worried about a parent, a sibling, somebody at home, and how that becomes part of this training. Is this so? Basically, the question is this is this available to students who are concerned for family members?
Yes, I think that it would be available for all students.
Exactly.
Should be available for all students.
Yeah, in
And
fact, it's one of the primary reasons to do it.
right. And whether or not the student goes home with their own supply of Narcan is up to how the school delivers it. So it's if a school uses a community partner and the community partner brings that along and they provide that to the students. That's a really a local decision too. And if they don't bring it with them, if they don't leave school with Narcan, which I'm sure happens in some schools, they would definitely be told how they can get it if they needed to have it on hand at home.
Right. The Jessica Schirmer at the CDC is asking about whether we can share the slide deck that DOE is utilizing, and we certainly can do that, Jessica. That's not a problem. Just glancing at maybe some other questions here. With the new legislation requiring schools to offer the training, what's the process to monitor compliance? And what is the Maine Department of Education doing to remove barriers to help schools meet the requirement? Yeah, I actually just saw a bill printed, but I think that didn't deal with this part of our naloxone saturation policy, although it did deal with another part of it, frankly, which was potentially penalizing EMS services that don't take the mandatory training and don't offer leave behinds. Different bill, it's just printed this week. But all of these naloxone initiatives are part of our broader strategy of having naloxone available where we need it. Leave behinds for EMS, mandating that it be carried by the police and law enforcement, offered to all the students in the schools, and because it's saving lives. We know it. We know that it works.
And I would say for that question though about what is Maine DOE doing to remove barriers? This is what we're doing. We started in 2019, 2020 with let's create a policy. Let's share how schools can access naloxone, and it's gotten a whole lot easier since 2020 to get Narcan in a school. So in addition to just providing all of the materials they need in order to teach it to their students, we're also saying, okay, here are all your community partners. Call your partners. They have it in your community. Ask them to come to your school. They can do this for you and with you, making sure that we're connecting all of those people.
Now, the question on fake pills is worth noting. Fake pills continue to be a risk, and the one pill can kill campaign from the DEA is something we utilize still quite a bit in our advertising. The question really was, could educating the parents on the dangers of fentanyl being in pills, in fake pills, could that be of value in softening some of the parents' attitudes who think that, oh, we shouldn't be talking about this kind of thing in school? You want to tackle that, either one of you? I will. I mean, I mean, yes, I think all of this is our adolescents are at great risk. I mean, as I say, the overdose review panel, had to review, chose to review in detail the lives of those three young people who were not old enough to have acquired a substance use disorder. At least one case could have easily been the first use of that individual. And so parents need to be educated about the risks that are out there. And all of this is absolutely part of that. I think we've answered most. I'll scroll down one more. Any thought of having advertised? We do advertise to the public through our options campaign, particularly. You can barely go on social media and not see our options initiatives there. We sponsored the Mariners game the other night. We have a lot of public campaigns from both the CDC, the Maine Prevention Network, OBH, the options program. If a youth voiced concern that a parent was using at home and the parent and the student want to be trained to administer Narcan and have it at home, would that not also necessitate a mandatory report phone call by the school to CPS? Probably a little beyond the scope of this. And again, we would look to individual school policies. We have home rule. Department of Education has sometimes very little control of schools. And so that would be up to the individual school and its policies and its lawyers. And then finally, did Narcan going over the counter help at all at making it normalized? We're working on it. It's been over the counter a year and a half now. But when I go into my local Hannaford now, there is a sign up that says naloxone available at the pharmacy counter. I'm so proud of them. It took a year, okay, but it's there now. And so I met with the Board of Pharmacy just yesterday to remind them that we want to do everything we can to help the over-the-counter piece help break down that stigma. And finally, we do have LD 710, which got a favorable unanimous report out of the Human Services Committee this week. Madison worked with me on that. And it does a couple of things. It lowers the statutory training requirements so that we can have nalox boxes all over and not have lawyers give us a hard time about how people are trained in it. The FDA has obviously determined that the package insert and the directions on the packet for the nasal spray are sufficient for people to be trained. We'd rather have more training. We have some 2-hour trainings in rescue breathing and things. But at the same time, we want bystanders to be comfortable to take that box out and use this nasal spray and keep a person alive. Finally, in addition to thanking Emily and Tammy, I meant to say at the onset that we have as many as 10 or 12 international visitors at this webinar that are in Maine from mostly related to United Nations drug control work, and they are visiting Maine to see how we do things up here. They're in this country for a few days and chose to look at Maine as a rural state that was making progress in this work. I had the pleasure of meeting with them in Portland yesterday. They are an amazing group of individuals ranging from the Dominican Republic to Spain, Germany, Austria, Brazil, and they wanted to watch this webinar with us. And so welcome to my friends. Safe travels back to your countries, and really was thrilled that you found our work to be of interest. Again, thank you, Kaylee, Emily, Tammy. Thanks to all of you. We had good participation today, and we'll see you all with our discussion with Roland in May. And have a great weekend.